It's all about doing good, you know, in the world and helping each other. And
we save lives every day.
It's now taken away for no real logical reason whatsoever.
We won't be here come September. It has nothing to do with what women need. It has all to do with what the state has been able to push through in the Capitol and making women's lives more difficult. Hi, I'm Amy Hagster Miller, and I am the founder of Whole Woman's Health. And I'm standing outside here right in Austin, Texas, where our company got started, and this is our first flagship clinic. And sadly, this is the beautiful facility that's going to have to close because of HB2 and the crazy laws that have passed here in Texas. And so one of the things I wanted to do today was invite you in the door of our clinic and walk you through the facility and talk to some of the staff and talk a little bit about what it is, the work that we do here, and let you kind of see inside and meet some of our team.
How may I help you?
Hey, it's Amy.
Come on in, ma'am.
So come on in the front door, and these are the first people that a patient would see when she comes in the front door. And part of what we do at Whole Woman's Health is we really focus on, you know, meeting the woman where she's at, trying to help her feel as comfortable as possible, and really combat the shame and stigma that women feel around reproductive health and specifically abortion. We have these fabulous women who meet people eye to eye, and
They don't know what to expect when they walk in the door. They don't know who's going to be here, so they're just absolutely nervous walking in the door. But making that direct eye contact from the beginning, greeting them, giving them the opportunity to calm down if they need to.
One of the things we do is we name all of our rooms after different women, so you don't have like the waiting room in the front desk. You've got here Frida Kahlo, you've got our other waiting room is named after Aretha Franklin. So part of what we're doing here is trying to welcome women and put them into a continuum of the thousands of women around the world and throughout time that have been in their shoes and that have shared the experience that they're having with us here at Whole Woman's Health of Austin. So I'm just going to walk you through like the normal course of what a patient would go through in her day with us. Of course, we're going to do it a little faster. The first step is usually lab. You come into the laboratory and you see our staff person Rebecca here, and we do blood pressure, temperature, pulse. We check the person's blood type, that kind of thing in the lab area. This is a ultrasound room. You can come on in here. This room is named after Indira Gandhi. And this is where we do the ultrasound for the woman, and it's oftentimes a pretty intense process for her. So it used to be that ultrasound was the time when we really had a connection with the woman, and it could be determined by what the woman needed and wanted to talk about. And now, since so many laws have passed in Texas, there's all these mandated things we're required to do an ultrasound. Like we have to do the ultrasound, then we have to describe the image to the woman whether she wanted it or not. Whereas before, Whole Woman's Health always offered to every woman, would you like to see her ultrasound? And it was done more in a patient-centered, woman-centered way. And now we have these scripts we're mandated to read, the doctor's mandated to do all these different things, and it's sort of changed that sort of dynamic.
We involve the woman. We let her dictate how the experience is going to go, what kind of experience she wants to have, and what's important for her, what's going to matter most to her during her time with us. And even though we have to comply with all these regulations and all this information has to be given, we want to give her the opportunity to tell us what's going to make it more comfortable for her.
Most of the time after ultrasound, a patient either goes into counseling or goes to what we call intake, which is sort of a demographic, financial, medical history kind of information exchange. One of the things at Whole Woman's Health that's really something we're really known for is our one-on-one private counseling session that we offer with women. Things they may be scared about, either related to abortion or related to sexuality or related to whatever's going on in their life. It's not a therapy session, but it's a time when people can ask questions, they can confront stereotypes that they've been told, and we can have an exchange that invites a woman not to feel so alone and invites her to see herself as part of a group of women who have experienced unplanned pregnancy in their lifetime and try to shed some of that shame and stigma. So here we're encountering Marva again. Marva is one of our most seasoned staff people here at Whole Woman's Health. She's a huge advocate and has really moved all around Texas, helping us keep our clinics open as long as we can. Marva was in Beaumont, then she was in Fort Worth, and we had to close the Beaumont office, and now she's relocated down to San Antonio, which is the one office that is an ambulatory surgical center that we're going to be able to keep open in Texas no matter what the laws are here.
I think this room is the room. This is the room where the women are the most comfortable. They've gotten to know us a little bit. They've been through a couple of steps. They've met the staff. They've noticed the flow of the session. A lot of times in this room, one of two things happen. Either we totally deconstruct and rebuild, or we learn that that woman has already dealt with this with her family and her loved ones, and she's ready to move forward. So this room is definitely meeting the woman where she is, letting her tell us what she needs from us, and giving that and fulfilling that for her. Since HB2, we've heard a lot of concern or complaint even about the move and the running back and forth on the highway, patients having to drive very long ways. Not only that, having to wait a little while to get into clinics now because there are clinics closing. The clinics that are open, the schedules are really bulked up, so patients are having to wait a while sometimes to get into the clinics, and we're hearing that more often from HB2.
Had a patient who actually, and her husband, her whole family actually drove their RV from Fort Worth because they couldn't get an appointment soon enough, all the way down here to Austin, and spent 2 days basically sleeping out in our parking lot in order to have the abortion at a time when worked for their family and worked for their work schedule. We also had a patient who worked in a casino in Lake Charles, Louisiana, and worked until 2 in the morning when her shift ended, drove all night to come here, paid for her abortion in 1s and 5s, brought her whole family, including her kids here, had their abortion here in Austin, and then drove all night again for them to be able to work the shift that she had to work again in the casino the next day. So this is the kind of stuff that we're already seeing, right, with HB2.
Yes, and unfortunately we predicted it will get worse because now there will be even more clinics that will close and even less access to the service that the women need. It's the women that we see right here in this room. I mean, this room, counseling, it's what decides whether you love abortion care or you don't, because you hear the stories and you hear what women are going through and why those women are here. And we save lives. We save lives every day. I can't tell you how many countless times I've had a woman hug me and say, I don't know what I would do if you were not here today. At the end of the day, abortion saves lives, and we're saving lives every day.
So after counseling, most of the women would either go to intake to make their payment, do some medical history, get pharmaceutical meds, they may get birth control pills, they may talk about the contraception that was discussed here in the counseling room. They're probably going to go and talk about an IUD, or they may get a depot shot. So it's sort of like the financial exchange and the medical history kind of exchange that happens at intake. In this room, we prepared an in-house movie at Whole Women's Health that kind of walks women through what to expect on the day of the procedure, and it's filmed with our staff in our building. We do this as a group. We have boyfriends, husbands, mothers, girlfriends, and the women who are patients all in here watching the film together, a couple groups at a time. And there's a lot of connection that happens between those groups of people where they talk, and there's sort of a destigmatization and a comforting peer-to-peer that will happen in this room when people are watching the film. And in here you see Miss Rebecca, and this is our procedure room named after Margaret Cho. And this is our largest procedure room, where sometimes we will not only provide abortions in this room, but we do colposcopies and other things, treatment of abnormal pap smears, and other gynecological procedures are done in this room. And, really simply, what happens when a woman has an abortion?
Well, it's really similar to when she gets a pelvic exam and a pap smear. The initial part of it is not like that. The exam table is a very familiar place for women who've been in a gynecological office. And then over here this is a packet of sterile instruments that we use during the abortion procedure, speculum, gloves. But oftentimes women are very nervous, and so when we come into this setting, we try to make it as comfortable for them as possible. The low lighting, the color of the walls, everything is set around helping her to relax and feel comfortable, including if she wants to see the equipment and the machines and everything before being seen that day for her procedure. We have no problem with that, because that can help kind of reduce anxiety, help her feel a little more control and understanding of what kind of environment she's going to be in.
So how long does the abortion take, like from when the doctor inserts the speculum until the abortion is done?
It generally takes about 5 minutes, sometimes 10 minutes, depending, if some people are easier to have their cervix dilated than others, or if they're kind of nervous, we may take a little more time inserting a speculum or that kind of thing. So it's a very fast procedure, especially when someone has sedation, when they have nitrous gas, or when they're, having medication to help them relax. That time goes by pretty quickly.
Some women choose that, some women need it, some women don't need it, and it kind of fits in with our philosophy about, women should be as comfortable as possible, and for some women, more meds are needed, and for other women, they're like, I'm fine, give me a local, I'm out of here, I gotta go back to work.
I found that this work has been very fulfilling, being able to work alongside women at a time when they need support, when they need love, when they need information, when they need to feel empowered about what's happening with their bodies. And that's something that we're able to do here. Not all clinics do that.
I gotta tell you, Rebecca was here on the very first day Whole Women's Health opened, on the first day we saw patients here in Austin, when I thought we'd have like 3 or 4 patients, and we had 19, and I had to call Rebecca out of bed to come and help me counsel all the patients. So that was 11 years ago, and now Rebecca is in medical school, and she's doing some fabulous things to make the world a better place for women. So after the procedure, most women, you know, just walk themselves to the recovery room. They don't need a stretcher. They don't need an ambulatory surgical center. They don't need general anesthesia. They can just actually walk down the hall, and they go into what we call an aftercare room, which is right down the hall. Here you'll see the recliners. This room here at Whole Women's Health is named after George O'Keeffe. And this is where the women come post-procedure, and they hang out here in the recovery room. Some of them have had sedation, others have not had sedation. Here's where we monitor their vital signs.
This is actually one of my favorite rooms because it's the end of the visit. You know, when the patient first comes in, there's a lot of fear, there's a lot of concerns, and as they go through the process with us, you know, lots of those get answered by meeting our staff and talking about what's important to them. And then once they get here, you know, they've had the procedure. A lot of times their loved ones are with them here.
So you see the men and the moms and the girlfriends really involved in learning the aftercare instructions. How can I help her? And thank you so much for your care, and that kind of thing. There's like a reuniting that happens that's oftentimes really powerful to watch. Yeah. When I was walking down the hall, I made a reference to the ambulatory surgical center that we're required to have in Texas from September on, and I can't even begin to describe to you how different that environment is from this private, you know, doctor's office, clinic-based setting. Not only the hallway widths and the size of the operating rooms and the operating lights and the air conditioning system that makes it cold, and we can't have fleece blankets that are warm and fuzzy. We can't give people, you know, warm tea in the recovery room. And, you know, to me it really sits down in this room. The recovery room in the ambulatory surgical center is so different from this. It's not this sort of warm, comfortable feeling. People are on stretchers, they're divided by curtains, it's really sort of medical, there's machines beeping and buzzing all the time, and really changes women's experience. And that's one of the things I think a lot of us feel a lot of grief about, because it has nothing to do with medical safety, it has nothing to do with what women need, it has all to do with what the state has been able to push through in the Capitol, and making women's lives more difficult. And seeing these clinics that we have built and that we have grown the staff and have grown the physical plants, we have to close the doors here and walk away from this model of care in Texas, and figure out how we're going to have this intimacy and have this connection with women in a mini hospital setting.
I mean, it's pretty devastating. It's been hard. We've currently closed 2 clinics, on the verge of closing 2 more. So it's an impossible thing to deal with.
It's heartbreaking because it's been over a decade of fabulous abortion care, nothing but offering a community service.
We've got some really dedicated, fabulous people spread all throughout the state here. And we have a lot of grief for what women are going to have to go through in this state, both to access care and also to get the quality of care that doesn't just treat their uterus, but that treats their whole body and their spirit to the extent that we do here at Whole Women's Health.